Good evening. Welcome to the Government News Brief for Thursday, April 6, 2017. In the news this evening, one female amongst the latest batch of BIT graduates in Region 5, media tour of the Sussex Street drug bond shows that it is still in use, and the Parliamentary Committee on Social Services visits the Diamond Hospital for a first-hand look at its operations. These and other stories when the news returns. Thank you for staying with us. I'm Paul McAdam. Here are the details. A lone female is amongst the latest batch of Region 5 youths who graduated yesterday from the Board of Industrial Training Program, BIT. Here is more. Anicia Pyle is one of the few young women you will find operating a bobcat. She was the only female in the class of 20 who graduated from the Board of Industrial Training's National Training Program for Youth Empowerment yesterday. The class successfully completed 6 months of training in heavy-duty machinery operations at the Marconi Technical Institute.
I have been doing heavy-duty machinery at TI. While my time at TI, I learned how to operate a bobcat. Also, I learned the main parts of it and how it works. I've learned also how to drive it, how to fit sand, and it is very interesting. I am planning to continue my study from September at TI in Georgetown, doing the same course, so that I can become a mechanic in future.
Jomal Johashin, who collected his certificate of training, expressed his gratitude for the program, which he said has equipped him with a new skill set.
The trade that I went to learn is fitting machinist, and through the course I experienced a lot of things like how to set up a job, how to start a job, what the basic thing, where the tools where you have to get before you set up a job. And I'm glad if I have a couple of young people with me come together and we're going to go out there and achieve what they want. Even the one who come out of school with CXC and still can come and learn a trade and get your skills, that if you get the education but you still can have a skills and you can make little money out there.
Congratulating the students, Minister within the Ministry of Social Protection, Keith Scott, emphasized the value of an education. 34 persons had enrolled for the training, but only 20 completed it.
It is for us to understand there are many reasons why people can drop out from a course. It could be poverty, it could be loss of confidence, it could be peer pressure, it can be a lot of things. Having an education of whatever sort was more important than staying at home.
So far, over 100 youths have graduated from the Board of Industrial Training's program in Region 5 for 2017. Paul McAdam for the Government News Brief. Non-specialized primary health care professionals are to be trained to effectively combat mental health issues in Guyana. Delicia Haynes tells us more.
The Ministry of Public Health, through the Mental Health Unit, is working towards having at least 50% of non-specialized healthcare providers in Guyana trained to address mental health issues. The training will allow these professionals to identify and treat these cases in a timely manner at primary healthcare level.
They will be trained to identify these main priority conditions very, very early so that they don't become serious, they don't develop a lot of complications and so on, to the extent where you have to be hospitalized, or you have to end up at the National Psychiatric Hospital, or you are behaving in ways that people are afraid of you, or anything like that. So identifying these diseases earlier is important. They'll be doing quite a lot of education with the family and their carers, and they'll be diagnosing and treating these stable conditions.
The doctors will be trained using the World Health Organization recognized MHGAP IG standard. This is a guide that has been developed for use by healthcare providers working in non-specialized healthcare settings after adaptation for national and local needs. This training stems from initiatives outlined in the National Mental Health Action Plan 2015-2020. Dr. Richmond Thomas says the plan advocates for transitioning from institutionalized mental health care to community mental health care.
One of the major things in the National Mental Health Action Plan 2015-2020 is community mental health care. So that's a major direction in which we're going. We're changing from institutionalized mental health care to community mental health care. And one of the largest initiatives in community mental health care is training non-specialist doctors in Guyana to combat the major mental health conditions. So we call these conditions priority conditions. There are depression, self-harm, suicide, psychosis. There's drug and alcohol disorders, epilepsy, dementia, and a few other conditions, but these are the main ones.
The MHGAP intervention guide for mental, neurological, and substance use disorders is also a technical tool for non-specialist health settings. The work of the Mental Health Unit is guided by two main strategies, namely the National Mental Health Action Plan 2015-2020 and the National Suicide Prevention Plan 2015-2020. For the Government News Brief, Delicia Haynes.
The Ministry of Public Health today gave media operatives a tour of the Sussex Street Drug Storage Bond. Details in this Isaiah Braffett report.
The tour of the Sussex Street Bond was facilitated by the Ministry's Public Relations Officer, Terence Ezeboom, and warehouse manager for the Diamond Medical Drugs Bond, Silhouette Craig. Ezeboom says that the purpose of the visit was to give the public a chance to see that the bond is being utilized.
People are interested to find out, to see some progress, whether things are different from when they came the first time. So it's just an opportunity for people to judge for themselves rather than the ministry putting out and releasing something for you to come and judge for yourself to see whether the bond is being utilized for the purpose of which it is rented, and to judge how things are now from how it was then.
Supplies for both the Georgetown Public Hospital Corporation GPHC are stored at the Sussex Street Bond. In addition, the Ministry of Public Health is utilizing some of the space at the Sussex Street Bond to store medical supplies because there is no space at the Diamond facility. Warehouse manager for the Diamond Medical Drugs Bond, Silhouette Craig, says supplies that come in early are stored at the Sussex Street Bond.
We have an advance delivery notice that comes from the supplier before the date of delivery, and we check the items against the contract to make sure that the items are correct, the quantities, etc. And we receive it here. However, we do not do dispatches here. What we do, we replenish supplies for the Diamond Bond MMU from here. So basically we do storage here.
Condoms, lubricants, insulin, omeprazole, and other medical supplies are some of the drugs stored at the bond. However, the ministry's PRO says that even though things are much better compared to the last visit, there can still be some improvement.
In any enterprise, things can improve, things can get better. And if the media spotlights something, I'm sure that the ministry and the GPHC will listen to the critique and improve things. I mean, that's how we get progress.
$180 million has been budgeted for the renting of the bond in 2017. However, the contract is under review by Cabinet. Isaiah Braffett, Government News Brief.
The Social Services Committee of the National Assembly is urging the Diamond Hospital staff to remain committed as they promise to rectify several issues raised today. More in this Seneca Thorne story.
The Parliamentary Sectorial Committee on Social Services today visited the Diamond Diagnostics Center as part of a list of scheduled visits to health facilities in Guyana. The purpose of the visits is to examine the operational procedures at hospitals while observing conditions under which health care is offered to the public.
There are things that could be done right away. There are minor issues that could be dealt with immediately, which I think hopefully with the coming to light with all these things, that it will happen sooner rather than later. I think that the staff, I would want to congratulate the staff. I think they're going way beyond the call of duty, working extra hours, going to ensure that there are services that can be delivered.
Dr. Mahadio adds that the Parliamentary Committee will meet shortly to have these issues addressed. Meanwhile, the staff reaffirmed their commitment to their respective jobs and were urged by the committee members to maintain their dedication.
We are going to meet on the 17th and discuss these visits that we would have made. I would like to wish the staff here all the best and hope that they continue giving up their best whilst getting improvements.
Drugs and medical supply shortages are among issues raised during the visit.
The Ministry of Public Health has launched a series of investigations to determine the root cause of this. Public Health Minister Waldo Lawrence is continuing to visit health facilities to monitor the acquisition, distribution, and consumption of these supplies. For the Government News Brief, Seneca Thorne reporting.
The Minister of Education, Dr. Rupert Roopnarine, says that government is open to suggestions on alternatives to the proposed 14% value-added tax or VAT on private tuition. Delon Sanko has more.
Education Minister Dr. Rupert Roopnarine will be part of a government team which will meet with parents and operators of private schools. The meeting is scheduled for 11 a.m. April 7th at the National Cultural Center. The meeting is in response to the public outcry against VAT on private tuition school fees.
I'm going tomorrow to listen. And then in terms of finding a solution, we have to sit with them, and then we have to sit with my colleagues on the cabinet to see what. Because, the VAT in education is really being thought through by the Ministry of Finance. It's come to us as a proposal. They have a lot of, financial reasons why they are bringing this. I myself, have been talking to teachers, talking to parents, and it has not gone down very well. So we have to address it.
Minister Roopnarine explains that hearing from parents and operators of private schools is crucial to making a decision on the way forward. He also explains that whatever decision is arrived at would have to have the buy-in of Cabinet.
Once I can do that, then I think we can approach Cabinet with more, a more thought out and agreed on position, but it'll go before Cabinet.
This tax requirement on tuition for private schools came into effect following the passage of the 2017 national budget. Delon Sanko for the Government News Brief.
We've come to the end of today's edition of the Government News Brief. The details of these and other stories can be found on GINA's website. GINA has an active Facebook page, and we encourage you to visit and like us so you can be informed as the news unfolds. Do join us again tomorrow for another edition of the Government News Brief. I'm Paul McAdam. Have a great evening.